Most people think ultra-processed foods just means junk food, chips, candy, or soda. But the truth is they go far beyond that. Think about your usual breakfast or lunch. Cereal from a box, flavored yogurt cup, or maybe energy bar or a protein shake on the go. And how about packaged bread, flavored oatmeal packets, sweetened almond milk, or frozen healthy meals? And all of those fall under ultra processed foods. They're made in factories, not kitchens, using ingredients you wouldn't normally find at home, such as refined starches, seed oils, flavor enhancers, colorings, emulsifiers, and preservatives. These foods actually are designed to be shelf stable. They're tasty, they're addictive, and they require no cooking. But what they take away is the natural nutrition your body was built for. So in today's video, we'll talk about what ultra-processed foods really are and review the latest study showing a strong link between these foods and colon cancer risk. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. So why do we eat so much of ultra-processed foods? Well, let's be honest, we all do it because they're convenient, they're cheap, and they're everywhere. But here's the hidden cost. Our bodies were never designed to run on man-made formulations. Ask yourself, how many foods in your pantry would your great-grandmother recognize? And if she wouldn't have had it in her kitchen, chances are your body doesn't know what to do with it either. When ultra-processed foods dominate your meals, they actually start altering your gut microbiome. They increase inflammation and they raise your blood sugar and insulin levels. And over time, that chronic internal stress can lead to disease and even cancer. So let's look at the latest study from Norway that looked at this connection closely. Researchers followed over 77,000 women for more than 17 years and tracked how much ultra-processed food they ate. They used something called the NOVA classification, which ranks foods by how heavily they've been industrially processed. The highest intake group ate more than 466 grams, about 1 pound, of ultra-processed food daily. And that's not hard to reach because if you add up packaged snacks, sauces, bread, and frozen meals, that's actually pretty easy. So what did they find? So during the study, about 1,600 women developed colorectal cancer. Women who ate the most ultra-processed foods had a 24% higher risk of colorectal cancer overall and a 58% higher risk of right-sided colon cancer. So the right side of the colon is where food residue first arrives from the small intestine, an area that is rich in bacteria. So researchers believe that chemical additives, low fiber, and disrupted gut microbes may inflame this region and promote abnormal cell growth. And a little bit more about the fiber. So the risk was even higher in overweight women who had a low fiber intake. Fiber from fruits, vegetables, legumes, and whole grains acts like a broom for the colon. It moves waste, feeds healthy bacteria, and keeps your immune system calm. So when we eat low fiber diets, which are full of processed food, we starve our good bacteria and feed the harmful ones. And over time, that imbalance, which is called dysbiosis, can set the stage for chronic inflammation and disease and cancer. So what is the big picture and personal prevention? So the study is a reminder that the food choices we make every day now truly matter because colon cancer doesn't appear overnight. It can take decades to develop, which means that your daily habits now are quietly shaping your future health. And here is something equally important. Not everyone who eats ultra-processed foods develops colon cancer, thankfully. And that's because each of us is biologically unique. We all have our own gut microbiome, which is this living ecosystem of trillions of bacteria that interact with our immune system and metabolism. And some people have more of protective bacteria, others have more species that promote inflammation, and also add to it genetic predisposition, childhood exposures to toxins, or antibiotics and lifestyle factors like stress and lack of sleep. And it's clear why ultra-processed diet could have different effect on each person. But in general, what can each of us do? So the best way to protect your gut before it gets truly sick is to eat real whole food and to understand what is happening inside your own digestive system. And if you would like to learn more about your gut health, you may be interested in functional gut testing. And those are advanced tests that can measure your microbiome balance, detect conditions like SIBO, which is a small intestinal bacterial overgrowth, dysbiosis, candida overgrowth, H. pylori colonization, and other digestive imbalances, while at the same time evaluating your digestion, your immune activity, and inflammation markers. And because your gut doesn't just affect digestion, it influences your energy, your mood, your immunity, joints, skin, and even your brain function. So at our clinic, at Mindful Medical Functional Clinic, we focus on gut health and provide gut-based personalized treatment. And if you're interested in our gut intensive program, and if you are a resident of Massachusetts, California, New Hampshire, or Vermont, call us at 508-444-6989 or visit our website at mindfulmedicalfunctionalclinic.com. And of course, remember, every healthy choice counts. Start with one small change. Add more whole foods, cook more often, and of course, listen to your body, because when you feed your gut well, you essentially feed your whole body, and your body appreciates that. Thank you so much for watching. Please like, share, subscribe. I'm looking forward to reading your comments as always. Thank you so much. Until next time. Bye-bye.